How is an incisional biopsy performed? Imagine having a small piece of a suspicious spot or tissue taken out to find out if it's cancer or not. That's what an incisional biopsy helps doctors do. It's a common way to get a good sample when a lesion or abnormal tissue looks concerning. This procedure is especially helpful when the area is too big or complicated to remove completely. The process starts with cleaning the skin or tissue area thoroughly. This step helps prevent infection after the procedure. Next, the doctor applies local anesthesia. This medicine numbs the area so the patient feels no pain during the biopsy. It's like getting a shot that makes the area completely numb. Once the area is numb, the doctor marks an oval or elliptical shape around the lesion. This shape includes part of the abnormal tissue and some normal tissue around it. Using a small, sharp scalpel, the doctor makes a precise cut along the marked line. The cut goes through the skin and into the deeper layers, often down to the layer of fat beneath the skin. The shape of the cut is usually an ellipse with angled corners. This shape makes it easier to close the wound later. After the cut, the doctor carefully lifts and removes the section of skin and tissue inside the marked area. They do this gently to avoid damaging the surrounding tissue. The removed tissue is then checked for bleeding, and any bleeding is controlled with pressure or small tools. Once bleeding stops, the doctor stitches the wound closed with fine stitches called sutures. These stitches usually stay in place for about a week and are removed later by a healthcare professional. The tissue sample is placed in a special container with a preservative liquid and sent to a laboratory. There, pathologists examine it under a microscope to find out what kind of cells are present. This helps determine if the tissue is cancerous or benign and guides further treatment. Most incisional biopsies are done in a doctor's office or outpatient clinic. The whole process takes about 30 minutes to an hour. The patient stays awake but comfortable during the procedure. Some mild discomfort, swelling, or bruising around the site is normal afterward. For families and caregivers, knowing what to expect can make the experience less stressful. It's important to keep the wound clean and dry during healing. Watch for signs of infection like increased redness, swelling, or pus. The biopsy results will help the doctor decide the next steps, whether that's more testing, treatment, or surgery. This procedure provides vital information to help understand what's going on inside the body and plan the best care possible.